Hey, acute care pros. When a patient presents with blood in vomit or stool, you're looking at a potential GI bleed, and time is tissue. Today, we'll walk through the red flags, critical interventions, and how nurses are the lifeline in stabilizing these patients. Gastrointestinal bleeding is classified as upper or lower based on the source of bleeding in the digestive tract. So, some common upper GI causes include peptic ulcers, H. pylori, NSAIDs, esophageal varices from liver cirrhosis, Mallory-Weiss tears, and gastritis. For lower GI causes, you'll often see diverticulosis, hemorrhoids, colorectal cancer, inflammatory bowel disease, and ischemic colitis. Hematemesis means vomiting bright red blood or coffee ground emesis. Melena is those black, tarry stools. You might also see hypotension, tachycardia, and dizziness. For lower GI bleed signs, look for hematochezia, which is bright red blood per rectum, cramping, urgency, or just visible bleeding. And don't forget the general signs of shock: weak pulses, altered level of consciousness, pallor, and cold extremities. Alright, let's talk about stabilizing the patient. First, you want to maintain the ABCs: airway, breathing, and circulation. Start 2 large bore IVs for fluid resuscitation. Administer isotonic fluids like normal saline or lactated ringers. And, always be prepared for a possible blood transfusion, so go ahead and type and cross the patient. Next, prepare for procedures. Keep the patient NPO and anticipate endoscopy if it's an upper GI or colonoscopy for a lower GI bleed. If ordered, insert an NG tube to help evaluate the bleeding source. Now, onto monitoring and medications. Check vital signs every 15 minutes during the acute phase. Draw labs, CBC, coagulation panel, BUN and creatinine, and liver function tests. Administer proton pump inhibitors such as pantoprazole 4 for upper GI bleeds. Use octreotide if you're dealing with variceal bleeds, and give lactulose if there's a risk of hepatic encephalopathy. And don't forget psychological support. Calm, clear communication really helps reduce anxiety for both the patient and their family. Make sure to explain procedures and provide reassurance throughout care. Always be alert for signs of shock, rebleeding, or any declining mental status. Document the color, frequency, and estimated volume of stool or emesis. And of course, collaborate with GI, surgery, or critical care teams whenever needed. GI bleeding can deteriorate rapidly, but with skilled, vigilant nursing, we can stabilize, reassure, and guide patients through the storm. So, have you managed a GI bleed in the ED or ICU? Share your approach in the comments, like, subscribe, and follow for more emergency nursing breakdowns, because your actions save lives.